Welcome to Texas 2036's virtual series, Straight Talk Texas, where you have a front row seat to conversations on topics important to our future. My name is Enisha Shropshire, Director of Board and External Affairs here at Texas 2036. Data is one of the most effective tools for decision making, and COVID-19 has elevated the need for accurate and reliable data. Today, Texas 2036 founder and chairman Tom Luce, along with Policy Director John Hryhorchuk, will preview a comprehensive COVID-19 dashboard created by Texas 2036 that presents critical health and economic data in an easy to visualize format.
Hi, everybody, and thanks for joining another session of Straight Talk. We all know now that we face a unique time in the history of our state and our nation. And when we first all confronted the fact we were dealing with a worldwide pandemic, I felt strongly that Texas 2036 was uniquely postured to insert into the many discussions that were occurring at every family dinner table and at policymaker tables and everywhere about how in the world were we going to thread the needle between lives and livelihood to deal with this pandemic. So with a small team of members here at Texas 2036, we jumped into the issue and started meeting with the state agencies involved in collecting data. We met with members of the governor's strike force and found that we could contribute, I think, in a unique way by building an easy to use dashboard that could inform the public and inform policymakers as to how to deal with this pandemic. And I've asked John, who is a key figure in making all this happen, to take you through a walkthrough of how we're setting this up, why we are displaying the items we are, and how we hope to build this over time. So John, why don't you take it from there, and then I'll jump in from time to time.
Thank you, Tom. I think it's first important to know why we're different in what we're doing here in terms of this dashboard, because a lot of viewers have probably seen tools in different places, but truly ours is unique in that it seeks to merge both the economic and health data into one easy to use interface. These are two very important stories to be told, and they should be told simultaneously so that policymakers and the general public can understand the interrelationship between the two. We also draw upon some unique data sets, looking at hospital capacity, impacts on small businesses, and we're working with partners to develop more and more unique data sets that you're not going to find very many other places. We couple that with a rigorous reopening analysis that looks at the president's 6 standards and the state and county level and kind of distills what's going on in terms of trends on as granular a basis as possible. And with that topic of trends, a lot of places will just give you the raw numbers and really focus on working on smoothing analysis and other things like that, so individuals can have a good idea of the direction that the state's heading in various components. So with that, I'll take you through the tool. So at the top level, we have a State Explorer option, which allows individuals to get a top level, most important data points vetted by some of the state's foremost medical professionals. And we look at what the trend analyses are for issues like testing, cases, syndromic data, all right up front. So as you scroll—
John, let me interrupt right there, because being the non-medical person here, I can speak with clarity that nobody knows what syndromic data means. And so I had to learn that that's a phrase that doctors throw around a lot to say, often we don't have time to test whether somebody actually has COVID-19. So in an emergency room, they all have for years characterized people with respiratory illnesses, similar flus, and they call that syndromic data. And so it's a good guidepost as to the issues we're facing without regard to necessarily COVID-19 testing data.
Yes, thank you, Tom. So we merge in the coronavirus-like illness data from the Department of State Health Services, the influenza-like illnesses. We also try to draw in as much hospital data as possible. so that people can have an idea of what our capacity looks like, both in terms of total beds, ICU beds, ventilators.
Let's stop right there, John. For instance, why did we want to include hospital data? What you want to do is make sure that your hospital system doesn't crash. So it's critical that we monitor hospital bed capacity. It's also critical that we monitor ventilator capacity, because that can be the issue that crashes your hospital system. So all of this is designed really at the end of the day to help individual Texans inform themselves as to how to be personally responsible to help in this crisis.
We put a lot of focus on trend data, and as you look at these various charts with regards to daily new cases or daily new tests, for example, trend data and the importance of it becomes clear, because you'll see spikes, and there's often a quip in the medical community that it seems that the disease takes weekends off. It's important that we know the real trend and directions and aren't distracted by short blips in data that might more reflect statistical anomalies than actual changes on the ground.
And by the way, John, you don't always have to thank me for interrupting. My children don't thank me for interrupting. But what I would say here is that's to get away from the fixation we all have of looking at the stories today in the newspaper or going online and seeing how many cases did we have today. But I think we all understand at some level it's not one day that matters, it's trends that matter. And you can have fewer tests, for instance, administered on a Sunday than you can on a Wednesday. So it's important for the public and policymakers to look at trends over time.
Correct. And when we start talking about trends, some of the most important trends that we're going to be tracking also had to do with economic trends. It's not a surprise to any of our viewers that there have been 1.7 million jobs lost in Texas over recent weeks. But one of the things that we do that's unique is we draw upon Workforce Commission data sets, data from the Federal Reserve, and data from some private sector partners, such as Homebase, to try to inform before not just job loss data, but what's happening to small businesses across Texas. So what we have shown here, for example, has to do with the number of businesses open. This is tracking payroll software for a statistically significant section of the small business community in Texas. And then you can check that against the number of hours that hourly employees are working and see this significant drop off that happened in March, but then gradually, slowly, it's moving back upward. So, we're working on building out the economic analysis because it is such an important part of this story. But it's not just looking at this at the state level. We try to get as granular as possible, looking at this.
Let me stop there before you go to the county level profile, because again, you see a lot of stories. Well, Texas is doing X, or Utah's doing Y, or New York's doing Z. But, people live in counties and in residential neighborhoods. And so it's really important that we look at this information on a granular basis, because, again, what we need people to know is what they can do to help out. And it differs whether you live in New York or you live in Amarillo or you live in Wink, Texas.
You're absolutely right. And that's one of the things we've really stressed in the county profile section is, there are 254 different stories to tell, and we want to make sure that Texans can go to one spot and find out as much information about those 254 stories as possible. So you can look at the color density up here and see the cases per 100,000. And places like Moore County are kind of facing a lot of the pressure right now. So let's zoom in on the scenario in Potter County, where we have 772 cases per 100,000, and you can see the test data on the county level as well. But even with this large level of cases, we can get the hospital capacity. And what you'll see is it's linked not necessarily just to what are the hospitals in Potter County itself, but what is the trauma service area. So if you're a patient from this area, where are you likely to be referred for treatment? And we have then located in there the bed capacity for that entire community. You can also get an idea of what the trends are in terms of the case data and on the county level. And we'll be working to build in additional granular economic data on the county level as we work with the Workforce Commission to refine through that data.
Let's talk about the practical use of this. We hope someday this will we can reach enough people that people in Amarillo will say, what can I do and what is my situation in Amarillo? And they can go to this website and find out, do I need to throttle back my activity? Even if the governor's order permits us to do X, Y, and Z, I want to make sure I'm fulfilling my obligation to the other people who live in Amarillo. Should I go out as often? Should I go to this business or that business? This gives you some information to make informed decisions. And we think an informed citizenry in our country will do the right thing and make the right decisions.
Moving to the reopening analysis, this is, I think, a truly unique aspect of our website. And it talks about what you were alluding to there just a moment ago with these trends and the ability to synthesize that data. As many individuals are aware, the president released 6 criteria that states should look at when deciding to reopen or how to reopen or at the speed of reopening. And what we've done is basically synthesize the state's data and apply a regression analysis so we can track within a margin of error the rates of change for various elements of the president's reopening criteria. So, for example, new cases per day. Anyone who's been watching the headlines would not be surprised to hear that the case per day is increasing in Texas. But there's the president looks at that and or the downward trajectory of positive tests as a percentage of total tests. And again, what we have plotted here is what is the rate of daily positivity for test rates. It's been pretty flat over the last 14 days, but the test volume during that time has increased significantly. So we track through these various items, including the syndromic data that we discussed earlier on a statewide basis with trends. And then we also look at the hospital data, which, one of the criteria is, can you treat without crisis care? And we look at how are we doing in terms of bed capacity, ventilator capacity, et cetera. A truly unique feature of this is we take it one step further and run that same analysis on all of our counties. Now, it's important to note that not every county has the same number of data points. So not all the analysis is quite as thorough. If you don't have, if you've had no cases, it is difficult to establish a trend line. But as we talk about, using Potter County as an example from earlier, we can really dive in on, what has the scenario in Potter County been? Well, over the last 14 days, there's been a rather sharp uptick in cases. Looking at their syndromic data, we have, despite that, a relatively flat level of reported symptom illnesses, influenza illnesses, and a bit of an uptick on the corona-like illness thing. And then lastly, we can get, just like we were talking about earlier, an idea of what the hospital capacity is like in Potter County, so that, again, as for the reopening criteria, we have an idea of how that and all the other communities in the Panhandle are able to handle potential surges as the economy reopens.
And, as the governor has talked about, and I know local officials are concerned, mayors are concerned, citizens are concerned. If you live in Potter County and you're watching this data and you see hospital capacity reaches 65%, then you say to yourself, whoops, we need to throttle back a little bit. If we find ourselves fortunate enough where we say, wow, it's going back down to 25%. That gives you another indicator. Now, I want to stress one thing. We all know and understand one data point can never be the decision maker. So that's why we've looked at a series of data points to help people make informed decisions. When it comes to policy or personal choices, we all in our life consider different data points. What we simply want to do is make sure we're getting the best current data available to the most people to make informed decisions. This is not easy. We have county health departments of various sizes, strengths. All of that data has to be reported to the state. Our state agencies are functioning like everybody else. They're being crushed right now by the volume of work that's occurring here. But I think this is a major step forward, and I want to applaud the state agency, but in addition to the Texas 2036 team that helped step in to help develop this tool, because it really can inform decision making.
Yeah, I absolutely agree. And, I'd be remiss if I didn't thank the staff at the Department of State Health Services and the staff at UT Dell Medical School who have been so instrumental in allowing us to know what data to curate for viewers of this website.
And that's important for people to know. This wasn't Dr. Tom Luce. I mean, we consulted with the professionals at Dell Medical School in addition to the state agency medical professionals. So this was really, truly a effort that was team-like, and we really appreciate everybody's help to make this occur. And as John mentioned, I think the important thing is we're going to be building this airplane as we're flying. We hope to add data points all the time. And that's what we try to do in every issue in our state, is say, if you want to know what's going on and make informed decisions and know what policies to adopt, you ought to go to the Texas 2036 website. And I think this really gives a great example of the work that we can provide that can really, truly make a difference in Texas.
Couldn't agree more, Tom. And, seeing this from your role in the strike force, seeing this from your role as our chairman, how has it kind of changed or impacted your view of the importance of data in tech modernization for state agencies?
Well, I don't know that it's changed it, but boy, it has brought it front and center. I mean, I had a long discussion with my grandsons the other night by Zoom. I'm like everybody else. I was meeting with my 7 grandsons via Zoom, and I was saying, a crisis, guys, doesn't build character, it reveals character, and it reveals strengths and weaknesses. And we knew all along that, we've had a difficult time moving into the digital age. And this pandemic revealed the fact of how much we're missing by not being able to move into the digital age in state government. But it's revealed it across the board. We've seen it in public education. We've seen the impact. And despite the best efforts of our amazing teacher corps and all the public education officials who jumped in to fill that void, we had infrastructure problems, broadband, digital divide, the lack of capacity and understanding how to live in the world remotely. And so I think, again, it's revealing at the governmental level what we're seeing in all sorts of different parts of our society. On the other hand, it's given us a great opportunity to say, what do we need to do to understand we really do need to move into the new age? And listen, as part of life post-pandemic, the new normal, the next normal, whatever you want to call it, we know that we're going to have to use information in a better way, a more transparent way to make informed decisions. You look at the private sector, my goodness, there's not a business alive who's not, quote, mining data all the time. We found out through this pandemic that, we can find out, for instance, I've seen visualizations of how, the beaches at Fort Lauderdale back there in March, how all those people dispersed across the country, and then how hotspots arose. Well, we learned that through looking at data. Well, this is the world we're moving into, and we're going to see transformative changes in medicine, health, delivery of government services. So I think we're just at the beginning of understanding the power of where this can lead us. But at the end of the day, regardless of whether you advocate for more government, less government, middle ground government, whatever, to deliver that element of government services, you need better data to be able to do it. And that's the role of Texas 2036. And so, I'd like to say to those listening in, send us your suggestions, send us your comments. We appreciate your support, and thanks for listening.
thank you all for watching Straight Talk Texas. If you have questions and feedback, we want to hear from you. Email us at straighttalk@texas2036.org and follow us on social media and sign up to receive our emails. Visit texas2036.org for more information. Until next time, wishing you and your family well.